The coronavirus pandemic has affected the entire world. The second wave of this pandemic has sent shockwaves throughout all of India. In the last few weeks, India has been plagued with an unprecedented shortage of hospitals, doctors, paramedics, oxygenated beds, ventilators and ICUs. This sudden shortage of oxygen has left thousands of people vulnerable and many others helplessly watching on as their loved ones lose their lives. Voluntary organizations such as BAPS Swaminarayan Sanstha have extended a hand of selfless service and worked together with local authorities to help alleviate the suffering. His Holiness Pramukh Swami Maharaj, the previous spiritual head of BAPS Swaminarayan Sanstha, laid the groundwork for this selfless service, while the present Guru, His Holiness Mahant Swami Maharaj, has also inspired and mobilised volunteers, devotees and well-wishers of BAPS Swaminarayan Sanstha both in India and abroad. Through the help and support of millions of well-wishers, supporters all over the world, together we are helping to make a difference. A large-scale campaign of oxygen service was carried out by BAPS Swaminarayan Sanstha in the UAE. BAPS Hindu Mandir Abu Dhabi, with the help of local rulers and donors, dispatched 2 cryogenic tanks filled with 44 metric tons of liquid oxygen from Dubai to India on the 1st of May 2021. This oxygen supply was provided to patients free of charge, with the flow of oxygen determined to continue uninterrupted for a month. Additionally, cylinders containing 4.2 million litres of oxygen were also delivered from Dubai to several hospitals in Gujarat. British Airways delivered a consignment of oxygen concentrators and emergency medical supplies from BAPS UK and other charities in a special relief flight at the height of the pandemic in India, all free of charge. So far, more than 1,000 oxygen concentrators have been sent to India by BAPS Swaminarayan Sanstha in the UAE, the USA, the UK, Kenya, Uganda and South Africa. These have already reached patients in hospitals and rural clinics in states and union territories around India, including Chandigarh, Delhi, Jammu Kashmir, Gujarat, Haryana, Himachal Pradesh, Maharashtra, Punjab, Rajasthan, Uttarakhand and Uttar Pradesh.
મારું નામ ડોક્ટર સુમનભાઈ પરમાર છે. અમે નાલીમાં દવાખાનું છે સિટી ક્લિનિક તરીકે અને ઘણા સમયથી હું પ્રેક્ટિસ કરું છું અને આ બાજુ ઘણા કેસીસ પડે છે. ઘણા દર્દીઓને ગામડાના દર્દીઓને ઓછું કરીને ઉપર ઓછું થઈ જાય છે, તો એને કોઈ ઉપર સુવિધા મળતી નથી. તો આપણી સંસ્થા BAPS સંસ્થા તરફથી ખરેખર એક આવકારદાયક પગલું છે કે એનાથી ઘણા માણસોને રાહત થઈ શકે છે, છૂટું લઈ શકે છે અને એમને બીજા મોટા દવાખાને શિફ્ટ થતા સુધી એમને ઘણી રાહત મળે છે. તો અમે ખરેખર આનો લાભ લઈ રહ્યા છીએ અને ઘણા દર્દી આનો લાભ અપાવી છે. તો ખરેખર આ એક આપણી સંસ્થા તરફથી એક ખૂબ જ આવકારદાયક પગલું છે.
Some of these efforts have been driven by innovative public campaigns. Volunteers of BAPS Swaminarayan Sanstha in the UK organised a static relay cycle challenge. The Cycle to Save Lives appeal. 787 participants cycled non-stop for 48 hours, covering a collective distance of 20,127 kilometres, almost 3 times the distance between London and Delhi. The Mayor of London, Sadiq Khan, as well as several other British politicians and esteemed individuals from various fields, joined the volunteers in the cycle challenge. They heartily applauded the efforts of BAPS for raising vital funds and awareness about the situation in India. Thousands of supporters came forward to contribute. More than 3,600 patients are currently being treated at 4 BAPS hospitals in Gujarat. The BAPS Pramukh Swami Maharaj Hospital in Surat, the BAPS Shastriji Maharaj Hospital in Vadodara, the BAPS Yogiji Maharaj Hospital in Ahmedabad and the BAPS Hospital in Botad. A total of 395 beds have been allotted for coronavirus patients in these hospitals, with oxygen facilities and ventilators as well as several intensive care units. Additionally, In collaboration with the Ministry of Health in Gujarat, BAPS has set up a special 500-bed COVID field hospital in the large assembly hall at the BAPS temple in Atladra, Vadodara. Hundreds of patients have been relieved through the provision of free food and infrastructure services provided by BAPS Swaminarayan Sanstha. All the beds at this COVID hospital are kitted with oxygen facilities made possible by a 13,000-litre liquid oxygen tank constructed rapidly on site. The nearby BAPS Swaminarayan Student Hostel in Atladra has also been converted into a COVID care centre, providing a further 50 rooms to treat many more COVID patients. Along with many medical services, BAPS Swaminarayan Sanstha is also providing free meals 3 times a day to patients, volunteers and the poor. Many BAPS temples and centres such as Valsad, Rajkot, Ahmedabad, Vadodara and Surat, amongst others, are delivering free meals to thousands of needy people directly to their homes. Vaccination activities are also being expedited at several BAPS centres around the world. A public awareness campaign for vaccination was also conducted, with His Holiness Mahant Swami Maharaj as well as Senior Sadhu Pujya Swayam Prakash Das Swami making a public appeal for everyone to join the vaccination programme. Free vaccination services have been provided by BAPS Swaminarayan Sanstha in collaboration with local governments in various centres in India, including Surat, Vadodara, Ahmedabad, Rajkot and Naryad, as well as internationally at BAPS temples in London, Toronto, in Canada and several cities across the USA. In addition, a government COVID antigen testing centre has been operating on BAPS premises opposite Neasden Temple in London for several months. Behind these efforts is a selfless network of Swamis and volunteers immersed in the service of humanity. BAPS Swaminarayan Sanstha's team of dedicated Swamis, volunteers, doctors and paramedical staff are working tirelessly day and night to save the lives of patients from all faiths and communities. During the first wave of the coronavirus pandemic, more than 1,200 temples and over 11,000 volunteers and Swamis of BAPS Swaminarayan Sanstha rendered selfless service around the world. In India, the Middle East, Africa, UK and Europe, North America and Asia Pacific. Relief kits and care packages were distributed to more than 9 million people. More than 12 million food items were distributed. Hot meals were delivered to more than 1 million people. More than 200,000 patients were treated at BAPS hospitals and mobile wards. More than 250,000 people were given counselling and guidance through phone calls. BAPS Swaminarayan Sanstha has provided this caring service to everyone equally, without prejudice or expectation, fear or favour. Our efforts continue daily in India and at all of our centres around the world. At BAPS Swaminarayan Sanstha, we truly believe that we are one global human family with shared responsibilities, shared benefits and shared values. It is this spirit of oneness that will unify us all during this crisis and beyond, with love, harmony and compassion for people of all faiths, backgrounds and communities.